A very good morning to you. How are you doing? I hope that you're well, you're happy, you're blessed. Karibu sana, it's so good to have you here. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And I'm very excited about this particular new day on the 18th of March 2026. It's such a good morning to be here to talk about everything health, because your health matters to us. So as I said, this is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And the show on air is Afya Clinic, where we talk about your health and you get to discuss what is important. Now, this month, we've been speaking a lot about endometriosis, hapa na pale, on the social media, you know, all that. And he said it's very important for us to extensively, that's the word, talk about endometriosis and get to know exactly what that is. Get to understand everything around it so that you will be able to know what are the symptoms. How would you know that this could be endometriosis? What are the treatment options? Yeah, and so today we'll be talking about that. And so tune in. I know this is a conversation that will help you understand more about this, to be able to help yourself or help someone else. We say information is power. All right. So karibu sana. But even before we get into the discussion, we'd like to know how your week has been, what you're thanking God for. Since the last time we were here on Wednesday last week, what are you grateful for? Unatuwatch kutoka wapi, unatuwatch na kina nani? And for that, our numbers are very open. That is 0721 105 105 on WhatsApp, 0721 105 105 on WhatsApp. We are live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. On all social media pages at Rachel Kahugu, I'll be able to get your feedback as well. All right. Now, I'll be reading your feedback, but as we continue is that, as I've said before, is that today we are talking about endometriosis. And to tackle this, we have one of the best gynecologists in Nakuru, in Kenya, in Africa. Tusemanga north of Limpopo, south of Sahara, all that. Today we are having Dr. Felix Atisa. He's the chairman of Kenya Medical Association and also a gynecologist. And so today he will be the best person to unpack this particular topic. So if you have any question around it, feel free to ask. So I'll just repeat our numbers. That is 0721 105 105 on WhatsApp, MBCI TV on Facebook, MBCI TV official on YouTube on the comment section. Rachel Kahugu on all social media pages. I'll be able to get your questions and we'll be able to give you feedback on everything that you'll ask in regards to our conversation today. So karibu sana. Once again, my name is Rachel Kahugu and you're happy to be here. Today we are on set with Dr. Atisa. How are you?
How are you?
Good morning.
Good morning.
Good morning.
Nice to see you.
Good to see you.
Yes.
Asante sana for coming.
Thank you.
I feel like we've been planning that you'll come, and it's so good to have you on set to speak about endometriosis, because it's a topic that has had a lot of questions, you know, and needs that we'll be speaking about. But karibu sana.
Asante.
For the people who are seeing you for the very first time, please introduce yourself, tell us what you do, and then you can get into the discussion.
Thank you very much. So, good morning, viewers. My name is Dr. Felix Atisa. I'm a consultant gynecologist practicing in Nakuru at the Nakuru Specialist Hospital, where I also serve as the board chair of the hospital. I also have, I work with the County of Baringo, where I also work as the gynecologist in charge of Eldamaravine Sub-County Hospital. And also I chair the departments of obstetrics and gynecology. To add to that, I've also been privileged to serve our medical fraternity in Nakuru as the chairman of the Kenya Medical Association up to about 3 weeks ago, when I completed my second term as the chairman. So I've done 2 terms as the chairman of Kenya Medical Association. I also completed my second term as the chairman of Kenya Obstetrics and Gynecological Society of South Rift, covering 5 counties. About 5 months ago, when I completed also my second term and handed over the mantle to my colleague. And I'm happy to be here with you today to discuss this important topic of endometriosis. Feel free to engage with me and let's join hands and discuss more.
Yes.
Oh, wow.
That's our wealth of knowledge right there and experience. And we're very honored to be able to be getting knowledge at such a time as this, especially for endometriosis. Why would you say it's important for us to speak about endometriosis?
Thank you, Rachel. Endometriosis is a condition, it's a medical condition affecting women, whereby you get what we call endometrial tissues, or tissues that line the inside or the inner layer of the uterus, being found elsewhere in the body other than the endometrium. So you find tissues of the inner layer or inner lining of the uterus being elsewhere, especially around the pelvis area. They can be in any part of the body, including the skin, even the lungs, even to the brain. It is very important to discuss this topic of endometriosis because it is a chronic condition. It's a chronic medical condition, very debilitating to the patients, and takes very long before it's diagnosed, and some will live with it for the rest of their life without even ever having a diagnosis, let alone treatment. It is very poorly understood to the general public and even into the medical fraternity, and very difficult to manage because of its nature of chronicity and recurrence. Therefore, it is important to, the first step to getting treatment is to know the condition you have. So it is very important that we bring this to the limelight and we increase public awareness about this condition so as to reduce the stigma and the pain and suffering associated with this condition. Yes.
Okay. And you've explained it very well on what exactly endometriosis is.
Yes.
And you've said the tissues would attach to any part of the pelvic area and sometimes even the brain.
Yes.
Would you take us through the process of how that could happen?
Yes. So, as we said, you have those tissues, and just from the outset, it is not cancer. You see, many of us know that if there is something growing in another part of the body and, spreading, it is always associated with cancer. So these are benign, what we call benign lesions. They are not cancerous lesions, but they are normal tissues of the uterus that have, for example, around the pelvis, they will be found, you will have deposits of those tissues, which we call endometriomas, around the ovaries or in the ovaries, around the tubes, the fallopian tubes, on the surface of the uterus, and very common around the umbilicus, and even to the, to the gut. You'll find them around the colon, the rectum, and the thoracic area. That's when now they spread to the lungs. And occasionally you may have a few of those deposits into the brain. How do they get there? There are many theories and many explanations to this, but the commonest is what we call retrograde menstruation. As we all know that ladies of reproductive age group have their regular menstrual flow every month. And the flow should be from the uterus outside, and then it recurs every month as long as the lady is ovulating and has the regular hormonal balance. So occasionally you get a bit of this menstrual blood and menstrual contents flowing back through the fallopian tubes and then flowing into the pelvis. So that is one of the commonest ways, retrograde menstrual flow. So you find in that process you may have endometrial tissues being deposited around the pelvic area. We also have theories about some of these tissues migrating through the lymphatic system, through the blood systems, into far or distant organs like into the lungs, into the brain, and into the gut. You may also have, the ladies who have undergone surgical procedures like cesarean sections, procedures like myomectomies, removal of fibroids, and any other pelvic procedures involving the uterus.
Yeah.
In the process of that process of the surgery, you may have some of those endometrial tissues deposits somewhere in the pelvic region other than in the uterus. We have also had theories about the immune system being unable to disintegrate some of these endometrial tissues that are found outside of the uterus. You find if there's dysregulation of the immune system, you may have them being deposited elsewhere. And our bodies naturally knows fights anything that is unusual. So when you find the immune system is unable to eradicate, so some of these tissues then thrive or spread to other parts of the body.
Okay.
Yes.
Now, the first theory that you have given, where there's flow that goes back through the fallopian tube.
Yes.
How does that happen?
I will explain it like this. That is not the normal flow. And allow me to use a very bad example. When you have a flu, you expect your mucus to flow outside through the nose, isn't it? I'm sure all of us, and I'm sorry for those who are having a breakfast right now. You allow me to use that bad example. But occasionally, when you have a flu, you have experienced some mucus flowing back, isn't it? So that is the kind of explanation. Ordinarily, the flow should be out, but you can have a few trickling, a little bit of this menstrual flow trickling backwards. Not all the time, but it can happen. So that is the nature in which it should happen, but it can happen. Yes.
Okay, I hear you. Now that we've been able to understand what endometriosis really is, how does it present?
Thank you very much. There is no specific, what we call in the medical terms, pathognomonic. There is no particular sign that you will point towards endometriosis. Something like, you look at someone and then know this one has endometriosis. There's no particular sign like that. However, the condition endometriosis presents very acutely or vaguely to a very chronic conditions. The commonest sign that may predict or point to endometriosis include chronic pelvic pain. Ladies who have had pelvic pain for many years or many months, and in most cases they've been treated severally for what is commonly referred to as PID, pelvic inflammatory disease, or some of them have been treated chronically for urinary tract infection. I always make this joke, and I'm sure the patients who have been to my desk, I've always told them, I also like using a bad example that infection kills. I always tell them there's no way you can be having an infection for the last 2 years and you're still alive. But you'll find people who have been treated for a urinary infection, but their kidneys are working well, their urinary system, the bladder, everything is working well. And sometimes when you even investigate, their urine tests are clean, there is no infection. So these are ladies who will have a chronic pain, pelvic pain, lower back pain, but when you do investigations like trying to rule out infections, you find that they have no infections. So it's the commonest cause. The commonest sign. Other common signs of endometriosis or symptoms depend on the location. For example, if you have an endometriotic lesion in the bladder, we said it can be around there, isn't it? These are ladies who will have pain when going for short call, and sometimes they may have blood stains in the urine, especially during the time of menstrual flow. Remember, those endometriotic lesions also bleed during menstrual flow. So if a lady has, so they may have blood stained urine. Occasionally they may have blood in stool. When they're going for long call, they experience spots of blood. If they have endometriotic lesions in the rectum or in the colon. Other symptoms include, but not limited to, infertility. Some of these ladies will present as their first complaint is that they've been married for 2 years or so, or they've been trying to get a pregnancy and they failed. Because these endometriotic lesions also affect the tubes, they may have tubal blockage, and therefore they present with infertility. They usually present with very painful menstrual flow, very painful, including, in addition to the lower pelvic pains, they usually have very painful menstrual flows.
Okay.
So those are the commonest, and also depending, as I said, on the location of that endometriotic lesions. For example, if they have an endometriotic lesion in the lungs, these are patients who will tend to have very severe chest pains, unexplained. When you try a few investigations, you find that the chest and the lungs are normal, unless you go invasive. But they also present with a blood-stained coughs occasionally, especially when they have menses. And these are people who can be construed or, thought to have even TB or lung cancers and all that. They literally cough blood during their menses. And I'm sure there are ladies who, especially if they have endometriotic lesions around the navel, around the umbilicus, during menses, they come and present to us that they always have blood stains on their umbilicus, on their navel. And when you examine, you find there's a small nodule. So some of them have lived with it and have no idea what it is. And some of them keep it to themselves because it becomes very, let me say, embarrassing to them, because they come and keep it ash, because every month they sort of have to put a tissue, like a pad on the navel, to prevent that bleeding. And for those who have severe cases, like if they have endometriotic lesion in the brain, they present with severe headaches, even convulsions during menses. These are young ladies or middle-aged ladies who literally convulse when they have menses, and society may think that they are trying to dramatize their menstrual flow, and sometimes they're even ridiculed, that they cannot handle menses. How can they convulse? But such ladies have to be taken through a series of investigations to try and know what is the exact condition. So basically, that's a summary of the symptoms. None of them is specific to endometriosis, but a patient can present with all of those or one of those.
Okay. So what I've gotten from your explanation, and it's something that many ladies speak about, is that painful periods are not normal.
Yes. Yes. Painful periods are usually uncomfortable because the uterus is literally contracting to expel. So it's like a mini labor for those who have never gone through labor. It's like every month you go through a small sort of labor. So it's that contraction as the uterus expels the menstrual flow that causes a bit of pain. But if the pain is too much, excruciating, that even interferes with your quality of life, you can't go to work, you have to use very strong painkillers, then that sometimes even admitted, then that is extreme. That needs to be. So menstrual pain should be fair or moderate, not too much to warrant you to be hospitalized. By the time it gets to that level, it means there could be a condition. In this case, even endometriosis could be the cause, among other things. Yes.
And how we say that with malaria, you'd know these are the early signs, or with TB, you'd know these are the early signs, and so you'd catch it early. For endometriosis, is there anything that you'd say, this is a very early sign, or this is what starts before it gets, too far gone?
Yes.
Would you say these are the very early signs that would tell you, go get checked?
Yeah, thank you, Rachel. Unfortunately for endometriosis, and as I said, there is no particular sign that you can pick and suspect so that you can quickly go for checkup. And that is why many ladies who are eventually diagnosed with endometriosis have had a long-standing pain. So the earliest signs are chronic pain more than 6 months that only, especially worsens during menstrual flow. it is not associated with any infections, then you have to be checked. That could be a sign of endometriosis somewhere on the wall of the pelvic region. But other salient signs, as I said, depending on the location, if you see blood in your urine, that's a warning sign that you must get checked immediately. But you see, it's for those who have endometriosis on the bladder. If you see blood in your stool, it is not always cancer, especially for ladies, or hemorrhoids and such kind of things. You see blood there, you must quickly get checked. But other signs may be vague. But when they persist, especially the pain, and ladies with infertility, unexplained, is what we call it, unexplained infertility. They've tried to conceive, investigations they don't yield to any particular problem, then they need to be investigated further for endometriosis.
Okay. I hear you. And I think on that we've been able to understand in depth what endometriosis is and to know the early signs and the signs in general of endometriosis. But at this point, I'd like for us to take a very short break and then we'll be coming right back. As we do that, I'd like for you to ask any question that you'd be having in the lines of endometriosis. And for that, our numbers are very open. That is 0721 105 105 on WhatsApp. We're live on Facebook on MBCI TV, Facebook page. We're live on YouTube on MBCI TV, official YouTube page. So on those two platforms, on the comment section, we'll be able to get your feedback. So for now, we take a very short break and then we'll be coming right back. Usiende mbali.
MBCI Television, transforming lives.
Hauwezi sema ya kwamba wakati wa mapenzi umeisha ati kwa sababu uko katika huduma. You will lose your marriage.
Do you even see me anymore?
Of course I do. Why are you asking me?
Then why does it feel like I'm competing with the whole congregation?
Leo nimekuja, hiyo mambo yote nataka kutengeneza. Nataka turudi venye tulikuwa kama zamani.
Really?
Yes.
Are you serious?
Very serious.
Kuna huyu founder wa TikTok mwenye ameanzisha TikTok mchinese, ujui?
Ngoja nikwambie. Mimi unaona simu yangu? Mimi siko. I don't accept.
Umenitupa sana kwa kizungu?
Ameni throw away. Ameni throw away.
Talo. Nataka urudie mara tatu. 33,000 thieves thought of Thursday Friday. 33,000 thieves thought of Thursday Friday. Rudia mara tatu mbio mbio.
Rudia.
33,000 thieves thought of Thursday Friday.
33,000.
Continue. 33,000 thieves thought on Thursday Friday.
33,000 totals on Friday. 33,000 totals on Friday. 33,000 totals on Friday.
God have mercy upon us.
Time when the world is searching for hope, purpose, and truth, God is raising a generation of women who believe in His word and walk boldly in His promises. Kingdom Seekers Fellowship Nakuru invites you to a powerful and life-changing gathering, the annual Kingdom Women Conference 2026, under the powerful theme, Hold On to the Promise. A divine moment where faith will be stirred, hearts will be empowered, and destinies will be awakened. This year's theme is drawn from Luke chapter 1 verses 45. Blessed is she who has believed, for there shall be a fulfillment of the things which was told from the Lord. Come and experience powerful teachings, uplifting worship, and life transforming encounters with God. Be blessed by anointed ministers of the gospel, including Apostle John Kemani William.
May you continue to use your strength ukaweze kuzalisha makusudi ya Mungu.
Reverend Naomi Kimani.
When we shall know our God, we shall be strong.
Reverend Sami Mahoya, Prophetess Winnie Andrew, Reverend Ross Achimega.
Bwana anakupa mema, kwa nini? Maana umempenda.
Pastor Julia Karanja and Pastor Asunta Juma.
We must raise women who will respond to the strange sounds that are within the community.
With a powerful worship led by Pastor Anzo. Join us from the 7th to the 9th of April 2026 from 9 a.m. to 5:30 p.m. daily at the Harvest Cathedral in Nakuru. This is an interdenominational conference, free and open to all. Register today at www.mbcimissions.com. For hotel bookings, contact the number on the screen. Borders to carry bed sheets and personal amenities. Kingdom Women Conference 2026. Because when a woman believes in God, fulfillment is inevitable. Don't miss your moment. Your season of fulfillment has come. See you there.
MBCI Television, transforming lives.
All right, we are back. Thank you so much for staying. This is the right place to be. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God. My name is Rachel Kahogo. Very happy and blessed to be here. We are here for the Afya Clinic, and today we are talking about endometriosis. To get to understand what endometriosis is, what are the causes of endometriosis, and how we can actually treat it, and if it's treatable, kabisa kabisa. And to help us unpack this particular topic, we have Dr. Felix Atisa. He's the chairman of Kenya Medical Association and a gynecologist, and so he'll be helping us unpack this particular topic. If you have any questions, feel free to ask on our WhatsApp number, that is 0721105105, on YouTube at MBCI TV official YouTube page, on Facebook on MBCI TV. Thank you very much for your feedback. I see they're coming in. Sana, we'll be getting to read all of that. Continue sending in your feedback and we'll be happy to answer. All right. Now, Doc, we talked about how endometriosis presents, or the symptoms of endometriosis before we took a very short break. One of the questions that I'm seeing, and it's very recurrent, it's on the causes of endometriosis. Does it have a family history?
Thank you very much. And from the outset, we had given the theories that explain how endometriosis occurs, or that is now the causes. And we said it's not cancer, but you find the cells can flow into the pelvis during retrograde menstruation, during surgical procedures, and when the immune system fails to break down some of those lesions. And it can also spread through blood or the lymphatic system. There is a genetic predisposition, meaning it can run in families. If you find your mother, your sister has that condition, it is not 100% that you will also have it, but you have an increased predisposition of having that condition. So there is genetic predisposition to that condition. Yes.
I hear you, and maybe that will answer the questions, the family history. But if you feel like there's anything else you'd want to expound on that, we'll be happy to do that. Now, as we talk about endometriosis, we said that even with knowing the symptoms, it's very important for us to know how we are going to treat it. And our first question on that would be, is it treatable? Is it completely treatable? Am I something you manage?
Thank you. So, good question. The beauty is endometriosis is treatable, but it's a chronic condition that can recur, just like flu. malaria is treatable, but you can have another attack of malaria. So we have different modalities of treating endometriosis.
Okay.
And usually we start from, from medical treatment to more invasive procedures that helps to treat this condition. So on the medical issue, at first there is even the investigations. How do we get there in the first place? Yeah, we start by, depending on what the patient presents with. If you have chest pain, coughing blood and all that, you will be taken through simple tests from the chest x-ray, going deeper to the chest CT scans and even MRIs. Same to pelvis. We may start from a simple ultrasound, pelvic ultrasound, then progress to a pelvic MRI to try and identify those lesions. Then eventually, when a high index of suspicion is made that this is likely to be endometriosis, we will go to more invasive, investigative, curative measures like surgery. And in this case, we talk about laparoscopic surgery or minimally invasive surgery, whereby, like for those who have undergone endoscopy to try and assess if they have ulcers or gastric or stomach ulcers, endoscopy is a similar concept whereby you make very small incisions, 3 or 4 on the abdomen. Then using a scope, we are able to visualize under magnification. We are able to visualize those lesions in the pelvis and actually excise them. And they are taken to the lab for what we call histology, to be analyzed to confirm. So that becomes curative and at the same time diagnostic, because that lesion that was removed is cured to you. It has been removed. Then the report comes to confirm whether it was actually endometriotic lesion. So once we have made that diagnosis, then the treatment starts, and that's why I said we have to manage the pain. Like if you have a toothache, the first thing is the pain as you wait for that tooth to be fixed. So we have we have an array of medical analgesics or painkillers. Number 2, we have different hormonal modalities, hormonal medications that help to suppress the spread and growth of those lesions and therefore reduce pain. Some of those hormonal medications also help to cut down or to knock off, so to say, menstruation. So we are sort of introducing artificial menopause so that you don't have those painful menstrual flows. And some of these hormonal therapies are very good, especially for those who have had their desired family sizes and they don't wish to conceive into the future. We also have hormonal intrauterine devices, the coils that we insert to reduce the pain related with the menstrual flow. So we have those medications, and then of course I said we have the surgical approach whereby we surgically remove or excise these lesions or curate them, what we call ablation, sort of burning them, but using the laparoscopic approach. Yes. So and as I said, once that is done, you get cured. The pain goes and all that. However, unfortunately, recurrences have been reported quite frequently. Yes.
Okay. I hear you. Now I'd like for us to look at some of the opinions of the people on endometriosis, to get to know what is your view on endometriosis, what you know, and that will also help us know if we need to do more sensitization on the same. As we started, you said that it's very important for the public to know more about endometriosis. That will help them understand what exactly that is and the causes and how to treat it, because there's a lot of stigma around it. And I'm praying and hoping by the end of having these kind of discussions, to reduce stigma any call around the issue of endometriosis and any other maternal health issue. For now, let's get the vox pops.
Endometriosis is a chronic pelvic pain ambayo inafanyika when the kuna some uterine walls zinaanza kumea kwa uterus ama fallopian tubes ama kwa ovaries. Ama in simple terms ni easy pain yenye inakuwa normalized sana sana during menstrual periods.
Endometriosis is basically like a period that's not normal and it's extra painful, and yeah, that's just it.
On this topic, back when we were younger, when we were still unmarried, there was a notion of what we believed that the pains only existed because we were unmarried, because we didn't have kids. So we had a thing, we had a notion, a narrative that maybe it will get better. But sadly, I'm a mom of 2 already, and turns out the pains just got worse for me. I don't know if it's an issue, if it's supposed to be addressed with the doctor or not, but I just manage with the things that we used to manage to back in school, like the hot water on the tummy, the painkillers that don't last long, but it's a stress. For the young girls, we keep telling them that don't worry, just vumilia. By the time you get to an older age, by the time you get your first baby, this thing will be itakuwa imeisha. Sadly, it's not the same for me. That's not the case for me. I don't know if it happens to the rest of us, but that's not the case for me. So maybe there's help out there, because I will not find a permanent one at the moment. Yeah.
It's a pain that comes during the periods, and yeah.
All right, so that is the feedback that we have on endometriosis. What did you say about that?
Thank you for the feedback. That is positive, because at least people know there's a condition called endometriosis. That's a good step into managing this condition. But as our viewers and listeners have put it, there are a lot of myths about how to cure this endometriosis. And the message out there, first, there's a listener who has talked about this chronic pain, and when they were growing up as young girls, they were told when they get married, they have children, that pain will disappear. That is a myth, and it's shared by many people, many communities. But marriage and pregnancy and childbearing does not cure endometriosis. So we cannot advise our young girls or women to conceive, to get pregnant in order to cure this condition. Because we have had ladies with even 7 children and they still have chronic pain, and then you discover they have endometriosis. So pregnancy does not cure this condition. Number 2, someone talked about what they used to be told to put hot water on their tummies during menses and all that. Of course, it's because they were experiencing painful menses. And that was a way of trying to soothe the pain. So we have, and we talked about it, we have analgesics. We have painkillers that help. You don't have to use hot sponges and everything. But we have analgesics that handle that condition. And someone mentioned something to do with normalizing. You know, the society sort of tells ladies that it's okay to have pain, it will disappear, you know. It is the shoe wearer who knows where it pinches most. These ladies actually undergo excruciating pain. The joke I always make, there is a lady who ever asked me how labor pain looks like. And these were 2 scenarios. And I explained. Not because I've gone through labor, but I know what labor is, and therefore I've seen what they go through. And a few days later, I was trying to calm a lady in maternity that, oh, this will be normal. She almost kicked me because she told me that you've never undergone through this. You don't know anything about labor. So I will not claim to know how menstrual pain is, but a pain that makes a lady come to hospital in the middle of the night is not just something to be wished away. You know, most of these ladies come in the middle of the night and people say, she's just having her menses, let her go home. No, some of this pain can be very excruciating. We need to investigate it further. It is not just pain of menses. So the word, the information to all of us, to society out there, is that we need to always give an extra thought when a lady presents with severe menstrual pain.
Yeah.
It should not be wished away as just another pain. Yeah, that could be a pointer towards an underlying debilitating condition.
Yeah.
Yes.
Okay, I hear you. We have someone who's saying, I'm a fighter of endometriosis, and that thing can drain, but I thank God I'm free now, and I can balance, but it's not easy. All right, I hear you. Thank you for your feedback. We have Alice Gadoni, and Uliza about abdominal wall endometriosis. The endometriosis on the abdominal wall.
Yes.
Would you explain about that?
Yes. That's the. Thank you, Alice.
Yeah.
That we have already mentioned it, and we said endometriosis can occur any part of the body. So abdominal wall endometriosis is when you have those endometriotic lesions on the abdomen, on the surface of the abdomen, on the muscles, on muscle tissues of the abdomen, and the commonest location is the umbilicus or the navel. We've had many ladies coming with a small nodule on the navel, and that nodule usually bleeds during menstrual flows.
Yeah.
So their common complaint will be pain around their navel that usually is wet or has blood stains during menses.
Yeah.
So that's the classical presentation of an abdominal wall endometriosis. Others are those who may have undergone surgical procedures like cesarean sections.
Yeah.
And they start having severe pain along the scar. It is normal, but it heals. Some of those scars may form some what we call very thick granulation tissue, what we call a keloid. So when you have a keloid, it is not endometriosis.
Yeah.
But when you have 2-3 nodules that are usually painful on the scar, then that is also an abdominal wall, most likely endometriosis.
Yeah.
So such patients, we usually evaluate them, assess, and remove those lesions, and they get cured. But in the process, we also laparoscopically examine the inside of the uterus, the abdomen, to see if a similar lesion could be inside. Because the mistake we make sometimes is to assume that lesion is just on the abdominal wall.
Yeah.
So when you see an abdominal wall lesion, there is a likelihood that there could be other lesions in the pelvic or in the abdomen.
Yeah.
So, but during surgery, we assess all those lesions. So that is the classic presentation of abdominal wall endometriosis.
Okay.
Yes.
All right. Asma, good morning. I'm watching from Embu County. My spouse used to have painful periods, and doctors had talked about endometriosis. She also delayed to conceive for almost 2 years, but we thank God he did us good and gave us a baby. My question is, after she delivered, her periods haven't resumed, and it's almost an year now. Could it be associated with the said endometriosis?
Well, thank you very much, our viewer from Embu. Not easy to apportion it to endometriosis, but since you said your wife delivered a year ago, and we also need to know whether she's on any contraceptive use, especially for those who are using Depo, the injection, the implant, they may take prolonged periods or a longer duration before they resume menstrual flow. So, and some ladies, probably she's like breastfeeding. So when a lady is breastfeeding, some of them can even stay for more than a year without menstrual flow. So I want to reassure her that she is probably just okay. If she's breastfeeding, let her give herself some more time. But if it takes too long, she needs to be seen in the nearest facility for further evaluation. But it's unlikely to be associated with endometriosis. Probably due to the breastfeeding or the hormonal contraceptive if she's using.
Okay.
Yes.
How long would be too long? Because he said that the wife has stayed for 1 year now.
I wish I knew whether she's still breastfeeding. If she's still breastfeeding, that's okay. Some ladies can stay even for 18 months as long as they're still. There's what we call lactational amenorrhea, the lack of menstrual flow as long as a lady is breastfeeding. There are those who get their menses within the first 3 months after conceiving, but there are some who experience no menstrual flow until they stop breastfeeding. So as long as her spouse or his wife is breastfeeding, then we will reassure her and tell her that is still within normal. But after cessation of breastfeeding, if she stays for more than 6 months without menstrual flow, then she needs to be evaluated. If she's not on any contraceptive. Yes.
I hear you. Anasema Ruth Mumbi, thank you so much. I see you. We have Charles Laga. I see you. Anasema you're watching with your wife. Thank you very much. All right. Omayal Latala. Okay. I see you. Just sending your feedback, as I said before, is that we are live on Facebook and YouTube on MBCI TV. And on the comment section, you'll be able to get your feedback. On WhatsApp, that's 0721105105. We're able to get your feedback as well. So any question on endometriosis, we'll be able to give you the answers that you need. We have someone who's asking, can endometriosis cause passing of urine?
Passing of urine. Oh, well, thank you for the question. I don't know whether she meant passing of blood-stained urine.
Yeah.
Maybe. Because passing of urine should be normal. Actually, it's very abnormal if you don't pass urine.
Yeah.
But if you have endometriosis affecting the bladder, then you may have blood-stained urine, especially during menstrual flow.
Yeah.
Yes.
Okay. Last week, we spoke about UTI.
Yes.
And you said that you'd have frequent passing of urine. If that is what she's asking about, would you please clarify on that?
Oh, no, I get. Yeah, as we said, also depending on the location, but generally, as we said, it causes chronic pelvic pain. Therefore, it's just like if you have a mouth sore or a toothache. Of course, the whole mouth is painful, swallowing is painful and all that. So if you have a pelvic pain caused by endometriosis, and remember we had said most of these ladies have probably been treated recurrently for UTI, urinary tract infection. So yes, endometriosis can cause painful passage of urine. When you go for short call, it is uncomfortable and painful. It is a common cause or another symptom or sign of endometriosis, though not limited to endometriosis.
All right. Perfect. And so, as of now, we'd like to get this particular segment, and we'll be taking a look at the mythbusters. So if you have any myth that you've had, or something that you'd like to clarify, kama ni myth ama sio myth, about endometriosis, just share with us and we'll be happy to clarify on that, to know is it true or is it not true. But for now, I'd like for us to get healthy living. This is a segment that just allows us to know what to do to live a healthy life.
Hello and welcome to Afya Clinic, your trusted guide to better health and wellness. Today on Healthy Living, we are talking about a condition that affects many women, but it is often misunderstood: endometriosis. Endometriosis is a condition where tissue similar to the lining of the uterus grows outside the uterus. This tissue can be found on the ovaries, fallopian tubes, or even other organs in the pelvic area. Just like the normal uterine lining, this tissue responds to hormonal changes during menstrual cycle, meaning it thickens, breaks down, and sometimes it bleeds. However, because it has no way to leave the body, it can cause pain, inflammation, and sometimes scar tissue. What are the signs to look out for? The most common symptom is severe menstrual pain, more intense than the usual cramps. Some women often experience pain during or after intimacy, heavy menstrual bleeding, lower back pain, and often, sometimes, difficulty getting pregnant. It is important to note that symptoms can vary. Some women may have very painful experiences, while others may have mild or no symptoms at all. Now, what causes endometriosis? The exact cause is still not fully known, but experts believe it could be linked to hormonal imbalances, genetics, immune system disorders, or a process called retrograde menstruation. This is where menstrual blood flows backward into the pelvic cavity instead of leaving the body. Let's talk about management and treatment. While there is no permanent cure for endometriosis, it can be managed effectively. Treatment options include pain relief medication, hormonal therapy to control the growth of the tissue, and sometimes in some cases, surgery to remove the abnormal tissue. Early diagnosis is key in preventing complications and improving the quality of life. Lifestyle also plays a big role in managing symptoms. Eating a balanced diet rich in fruits, vegetables, and omega-3 fatty acids can help reduce inflammation. Regular exercise, stress management, and getting enough rest are also very important. And finally, a message to you, our viewer. If you or someone you know is experiencing persistent pelvic pain or unusual menstrual symptoms, do not ignore it. Seek medical advice early. Your health matters and your pain is valid. That's all for today's Healthy Living segment here on Afya Clinic. My name is Faith Poema. Stay informed, stay healthy, and see you next time.
All right, so that is what we've gotten from the Healthy Living segment, and I do hope that you've captured a thing or two, because that will really help you just understand what endometriosis is. Do you have something you'd like to add on that?
Yeah, so basically it affects almost 10% of our ladies in reproductive health globally. So that means 1 in every 10 ladies will suffer or is suffering endometriosis. And therefore we use such a time of the year, March being an endometriosis month, awareness month, to actually rally nations, rally governments, rally policy makers that there is this condition. We should not just narrow our concentration to malaria and other things, but there is this condition that is a silent I don't want to use the word killer, but it is a silent affecting homes, families, and quietly playing a big role in depression and depressive episodes in families. Because something I failed to mention, especially for those who are in relationships and in marriage, intercourse is part of it. Endometriosis or causes especially pelvic pain, and therefore very painful and uncomfortable intercourse, and therefore this will lead to family disharmony and breakups and all that. But you see, not so many of our societies are open about it. Matters sexual are usually kept in the bedroom and very silent. But you see, these are a group of people that have suffered many years without any intervention, without anybody even coming to their aid. And they rarely come, to report. And sometimes when they report, society ridicules them. That you are complaining about painful intercourse, where we are dealing with bigger issues like hunger and floods. So painful intercourse is not a killer, but it really affects the matrix of marriages and relationships and families. Therefore, I will use this opportunity to also rally that across board, so that we can have more thought into this condition. We can have more funding towards research into endometriosis, so that we can have better ways, cheaper ways of managing this chronic condition, both medically and surgically, so that we have more facilities, more health workers, more professionals, more gynecologists trained on this condition. So that way we are able to reach all sectors of society without discrimination. Because as I said, it pains the shoe wearer. So it is the one with endometriosis who is suffering. And we should not focus or fail to focus on their need for early diagnosis and prompt treatment.
Okay. Oh, okay. Yeah, that's, you've explained very well, Asante sana. And I think, as we said, is that we'll speak about stigma. Because you've mentioned that we have a lot of stigma around issues of endometriosis, maternal health in general. I know people are not able to speak about these things openly. Yet we have very many people who are struggling with maternal health. Men and women alike. And we need to get to a space where kama mtu hayuko sawa, we can speak about it and they can get help, and for them to know that it's not a killer disease and you're able to get the help that you need and it's easily accessible. And so we need to get to that part. Now, I'd like for us to look at some of the myths that are around endometriosis and to get to know if it's actually true or not. Okay? And the first myth that we have is that endometriosis only affects older women. Is it true?
That's a myth. It affects all women of reproductive age group. And reproductive age group means from the time a lady starts to receive a menstrual flow up to menopausal. A few may extend even beyond menopausal. And usually, most ladies, most young girls start having their menses at the age of 14. But it can start as early as 9 to 18 years. Menopause usually starts from 45 years to 55, but most of them get to menopause at 50. So it can affect the whole range of reproductive age group, ladies in a reproductive age group. It is not only for the older ladies, it is not only for the younger ladies, it is not only for the Africans or Asians, or it is global. It's a global condition. Yes.
Okay. And that endometriosis is just bad cramps.
Good, and we've talked about it. That is a myth, and most of these ladies have been dismissed, and that adds to the chronicity of the condition, delay and failure to diagnose, and therefore delay to give treatment. Most of them assume it's just bad cramps, bad luck. They are even told that even your mother used to have very painful, or your grandmother used to have very painful menses, or your elder sister. And you see, that's why we say it, there is a family predisposition, there is a genetic link up to that. And just to mention, this condition can actually, we've seen during surgery at Nakuru Specialist, this condition, we have had a lady a few weeks ago or months who had very deep infiltrating endometriosis, and she had presented with a small lesion on the abdomen, the one we talked about, abdominal wall endometriosis. So initially we thought we'll just excise the lesion and she goes home. But, and she had presented with very chronic pain for many years, and painful cramps and painful micturition, or when passing urine, when going for short call. So when we scoped, we went in laparoscopically, and we found actually the lesion was penetrating into the ureters. The ureters is what brings the urine from the kidney to the bladder. And it was deeply engraved, and one side, the right ureter had started being obstructed. So this condition can actually lead to other far-reaching conditions, like if that side of the ureter is obstructed, then it leads to, slow kidney failure and all that. So this condition can actually lead to affecting other adjacent organs, depending on the effect on that core organ on which the lesion is engraved. So with time, that ureter was going to be obstructed. So, it is a condition that really needs early intervention. Because for this lady, if it wasn't for the intervention, then probably who knows how long he was going to stay with a healthy kidney. Because she had already developed what we call hydroureters. That is obstruction of the ureter, and therefore partial urine flow. And you can imagine when urine is not flowing, it is backflow, and the ultimate effect of kidney failure and all that.
Okay. So it's not just bad cramps. You need to go get treated.
It is not just bad cramps. That is a myth. It needs to, when you have the so-called bad cramps, seek intervention by a professional, by a doctor.
Very important. And the third one is that if you have endometriosis, you cannot get pregnant. If you have endometriosis,
you cannot get pregnant. Now, that one I need to respond it very carefully. It is not a myth, but the way the statement is put is when we have ladies who have had children up to their desired family size and they have endometriosis. So when you have endometriosis, you can still get children. However, so it's a myth. When you have endometriosis, you can have children and you can still live a healthy life. However, endometriosis can affect your fertility. Therefore, assuming these lesions have blocked the tubes, caused what we call scarring of the pelvic region. Therefore, it leads to infertility. You are not able to get children. So not all ladies with endometriosis cannot get children. There are some who will get, some may fail to get because of the blockage of tubes, scarring of the pelvic region, and even having what we call endometriomas, endometriotic lesions on the ovary, and therefore interfering with menstruation, ovulation, and all that. Therefore, that way, endometriosis leads to infertility, and therefore a lady fails to conceive or get children. Yes.
Okay. So it's a very thin line.
Yes, between having children and not having. So if it affects your ovaries, your tubes, then you don't get children. But if it's just on the scar, it is not affecting, you will still get children, other than having pain and all that.
Yes. Okay. And that endometriosis can only cause pain during periods.
That's a myth also. It causes, the periods are more painful. But now the dull pain lingers on before the next menstrual flow. So endometriosis can cause pain during and even when you're not on, when a lady is not on menses. It can cause pain throughout. Yes. And when you have such kind of chronic pain that lasts throughout, whether you have menses or not, then that's a pointer towards a likely endometriotic lesion somewhere in the pelvis.
What else could be the problem if you have such kind of pain that lingers throughout the month?
As we said, infection is a common cause, but I always joke infection kills. You cannot have pain for 2 years. So infection can cause. There is TB, tuberculosis. We have found it. TB affects every part of your body except the hair and the nails. So we've had ladies with pelvic TB or abdominal tuberculosis, whereby you have what we call tuberculomas or TB, tuberculosis lesions on the uterus, on the ovaries, on the fallopian tubes, and therefore that causes pain or chronic pain. And many other causes of pain is ladies who have had pelvic surgeries like multiple cesarean sections. They have had other surgeries for whatever lesions or causes. They tend to have what we call pelvic adhesions, and therefore have chronic pain. And remember, the pelvis is not just the uterus and the tubes. There are also many organs around there. There is the rectum, so the pain can also be, from the digestive system. There is lower back pain, which can also be due to nerve issues, the vertebra being compressed and all that. So generally, this is a pain that needs to be investigated thoroughly, having in mind that endometriosis can be part of it. For ladies in the reproductive age group, we also have to know their menstrual history. We have things like what we call polycystic ovary. That's another condition altogether that causes chronic pain, interferes with menses, and has a thin line in symptom presentation. There's a very thin difference between the way polycystic ovary presents and endometriosis. They present almost the same way, with infertility, irregular menses, pain, and all that. For ladies in reproductive age group, we have to rule out other acute conditions, things like ectopic pregnancies. These are lady, pain, and then if you are, dilly-dallying and waiting to investigate for endometriosis, you may be losing something so obvious and that can kill if not tackled urgently. Ectopic pregnancies, like when you have a pregnancy outside of the uterus, commonly on the tubes. So many conditions that cause that kind of pelvic pain. Including and not limited to things like fibroids. I know those ones ladies know. And I don't like saying this, malignancies, cancers. So ladies need to be investigated. we have what we call pap smears or
Yeah.
cervical screenings.
Yeah.
All ladies must have their cervixes screened every 2 years.
Yeah.
Ikienda sana, 3 years. Don't wait for that abnormal pain,
Yeah.
abnormal discharge, abnormal bleeding to get
Go
checked.
get checked,
It's a bit
yeah.
uncomfortable, but we have ways you can do self pap smears and all that. But once every 2 to 3 years,
Yeah.
go to your gynecologist, go to your healthcare provider, go to your doctor, go to your facility of choice, and have a cervical screen, because we have, just like endometriosis.
Yeah.
Sorry to digress for 1 minute.
Yeah, okay.
Cervical cancer also takes long to diagnose. By the time you're told you have this cancer of the cervix and all that, it has been there for 10 to 15 years.
Yeah.
So that is why we advocate for all ladies to have screened all the way to the ages of 60, 65.
Yeah.
To
And you
make
said
sure
at
part of
least
the
2
health
years.
living.
Yeah. You said after at least 2 years, ikienda sana.
Yeah.
Yeah. Okay. Our last myth buster for today would be birth control causes endometriosis. Is it true?
No, that's a myth.
Yeah.
Actually, some birth control methods have been used to treat endometriosis.
Yeah.
So there is no birth control method as at now that is associated or known to cause endometriosis. Some of the birth control methods, like contraceptive pills,
Yeah.
have been used to treat the pain and bleeding or the heavy menses associated with endometriosis.
Yeah.
Sometimes we have used Depo, the injection, the 3-monthly injection, to actually reduce the menstrual flow and reduce the pain of endometriosis. And
Yeah.
remember, I said some of these hormonal methods are used, especially for those who have had their desired family size.
Yeah.
We have other hormonal therapies that are both for contraceptive and also treating the menstrual flow, the pain of endometriosis.
Yeah.
So birth control methods are not associated or do not cause endometriosis.
Yeah.
Yes.
Yeah. All right. Now, we have a question here. Nasema, I started experiencing painful periods when I was 15 years, which worsened as the time goes. But I thank God that I underwent surgery and now I can manage the pain.
Thank you.
Yeah.
That is good. Congratulations. We wish you good health.
Yes.
And good
Amen.
health.
Amen.
Healthy
Amen.
living.
Healthy living. Yeah. And so praise the Lord. Mine is, I had it last year. I had a critical prolonged bleeding, but after scan and test, I was given medication and my period stopped there and there. But nowadays, I'm seeing dark stains, then after 3 days, it disappears. Am I okay? Or still, do I go and get some checkup? It's now almost a year.
Yeah, thank you for that. But the information is okay. You need to get checked up. I wish I knew your age and whether you're on any contraceptive right now.
Yeah.
But if you have this, what we call irregular or dysfunctional uterine bleeding, irregular bleeding outside of the regular menstrual flow,
Yeah.
you need a quick checkup to your nearest facility, your nearest doctor, your nearest gynecologist,
Yeah.
to even have what we call a speculum examination, to examine the cervix,
Yeah.
and even do the screenings I was talking about, the pap smears and all that.
Yeah.
She needs to be evaluated.
Very important. Now let's speak kidogo about stigma. We have the issue of stigma around the issues of maternal health in general. What should you say people need to do better to reduce the stigma that is around the maternal issues, and specifically the issue of endometriosis?
Thank you, Rachel. We all come from communities and societies, and sexuality is kept, hush.
Yep.
No one should talk about it. I think that is where the stigma comes. I am privileged to be a gynecologist, and therefore, for me, my language is sexuality.
Yeah.
Sometimes you may find me very vulgar, but I see nothing about it. And many of my close friends, my close circles, think I'm vulgar, but nowadays they have gotten used to me, because if I don't talk of sexuality, what will I talk about? I cannot talk about construction. I'm not an engineer. I also talk a lot about politics because I am one, and I love politics and leadership. Anyway, the stigma associated with sexuality and endometriosis is mainly society trying to imagine that a lady who talks about her sexual health is promiscuous. You know, a lady who comes and tells you, oh, I don't enjoy sex, I have painful menses, I have pain when I'm going for short call, they are always considered to be having infections, and they're infecting other people. That is where stigma comes from. And therefore, just like the stigma of when if my wife slaps me, I will rarely report because I will be looked at as a weaker being. That is still stigma. We need to report these things. No one should be battered, whether man or woman. So I will wish to urge that as a society, we demystify some of these things. Let us be open, let us discuss matters sexuality, let us discuss reproductive health, even infertility, which may or may not be associated with endometriosis, is rarely talked about. And the people who are proud ladies, sometimes they open up, they come to our clinics, we discuss, and we are able to find problems. When we tell them that a man needs to be investigated too, that is where the consultation almost goes haywire. Because most of our men don't believe that fertility issues can be related to them. Statistically, 40% of infertility in couples is male factor related. 60% is female related. So 40% is a big number. So for every 10 couples who have not been able to conceive, 40% or 4 of them, the problem could be male related. And when we are doing investigations, we are not trying to apportion blame. We are simply trying to find where the problem is so that we seek a solution that fits that couple. So we need to open up, we need to talk to society, we need to talk to leadership so that these things become part of our common discussions, and therefore ladies or couples are not left suffering in silence when there is cure, when there is solution. So the more we talk about it, the more we talk about it in churches, the more we talk about it to schools, the more we talk it to society, then the more we demystify it, so that it should be seen as normal for a lady coming and saying, I have painful coitus. That should be regarded as normal and not, construed to sound very bad.
All right, I hear. And now, because we're getting a few questions about PCOS, I know that we'll be having another session, hopefully, to speak about PCOS in itself, because that's a whole other topic. But would you maybe in a minute or two explain what PCOS, polycystic ovarian syndrome?
Yes, I was very careful not to open a Pandora's box, because PCOS or polycystic ovary is another poorly understood condition, just like endometriosis. And PCOS also has a cure, has a treatment modalities, and it is bearable. But just 1 minute, polycystic ovarian syndrome is a condition. It's like saying this wall is white. Poly means many. Cystic, cysts on the ovary. So physically, you find that the ovary has got so many small, tiny cysts, usually measuring less than a centimeter, and they could be more than 10 per ovary. What does that mean? Your ovary is swollen, therefore there is chronic pain and worsens during menstrual flow. In the process, this condition interferes with your hormonal balance, and therefore these ladies have long periods of amenorrhea or long periods without menstrual flow, can even stay for 6 months. They have irregular menstrual flow, they have difficulties with conceiving, they have other symptoms because this condition is hormonally related, and therefore they have other conditions, not just the cysts on the ovary. The ladies have very severe acne. Most of them have been seen by dermatologists and have used several skin products. They have very severe acne because the testosterone or the androgens, male hormones in them is slightly high. They have facial hair, and for ladies we don't call it a beard, we call it hirsutism. They have facial hair. We have ladies, I'm sure you've seen it in the media, they have facial hair. And they may or may not have conceived because it is closely related to infertility. So most of them have had unsuccessful efforts of conceiving. They may have been diagnosed with infertility. So it also presents with so many other symptoms, and it is equally debilitating.
It is.
Yes.
It is. We'll get another day that we'll talk about that, in depth, to get to understand everything about PCOS.
Yes.
But for today, I've seen another comment here, and I should have read it. Kabla mkuje na mawe, anaitwa Dorcas, anasema thank you for the information. That's my incoming MP Kitutu Chache South, Felix Atisa. Dorka, nimekuona. Tafadhali. Sawa sawa? Asante. Thank you so much. As you've said, ni kama uko zote.
Thank you, Dorcas, and thank you for watching.
Yeah.
And thank you for wishing me well.
Yeah.
And to the viewers, yes, as I said, leadership, political leadership, or associations, even leadership in your own home starts with yourself. So I'm really passionate about political leadership, and I hope next year, August 10th, my people of a constituency called Kitutu Chache South in Kisii County will give me an opportunity to serve them. I'm passionate about it, and I believe yote ni ya Mungu. And these decisions are made by us humans through God. And I believe where there's a will, there's a way, there's a God, and it shall be well. So for the people watching me from Kitutu Chache South, thank you. Stay tuned. Tutakutana weekend.
All right. Now, we have a feedback from the lady that talked about critical prolonged bleeding, and then had a scan and a test and was given medication, and then the period stopped, and then has been seeing dark spots. And so she's saying,
1 year.
Yes. So she's saying that, thank you, though I did a pap smear last year and it was okay, no cancerous sign. Can this be related to cancer? And also with age above 45 and menopause.
Oh, she's above 45.
Yes.
Yeah. If that bleeding has prolonged, then we need. She needs to be seen. There's a procedure we call, and I'm happy that she did a pap smear last year. Then we need to do what we call endometrial curettage. It's a simple, day procedure where we take tissues from inside of the uterus, and then it is taken for evaluation. I think if that bleeding for her has prolonged that way, then we need to do. And the fact that she's above 45, we need to know whether she's diabetic or not, and hypertensive, because diabetes and hypertension are also associated with other what we call endometrial conditions and uterine conditions. So yes, she needs to have that procedure. It's simply getting endometrial tissues, then taking them to the lab for what we call histology or investigation to try and see whether they are normal cells or abnormal cells. But she needs not to,
so it's not cancer.
When we mention some of these things, patients go there thinking, so the doctor thinks I have cancer, and therefore she stops eating and gets depressed until that result is out. Let her continue with her normal life, but pay a visit any of the days for that simple test, but it should not give us sleepless nights.
Okay. She's saying, I have almost 5 years now with no periods. Is it menopause or what? I'm now 43 years old.
5 years. Thank you. She didn't mention her name.
She didn't mention her name.
5 years without menstrual flow and you're below 45 is not normal. Because the normal age of menopause is 45 and above. However, we have what we call premature menopause, or what we call premature ovarian failure. The ovary fails or stops functioning normally and producing the normal hormones, what we call the estrogens, and therefore it makes you stop having menses earlier than it was expected. So she needs to come for investigation. We have 2 or 3 hormone tests that we shall do to know whether she has gone into premature ovarian failure, and therefore we can only, support her through that early menopause period. But we cannot now like give her medications to start getting menses again. When a lady has gone into premature ovarian failure, you can only manage the postmenopausal symptoms. But as at now, we do not have, there are researches going on, but we do not have a current way of rejuvenating the ovaries, maybe into the future. But yes, so she just needs a hormone test that can be done, and within 5 hours she will know.
Okay.
Yes.
Malimali has a feedback for us. The one who spoke about experiencing painful periods since she was 15 years old. She's saying, let's talk about these. Let's have this talk in our society, in our church, in our schools to bring awareness, and also hope to some that have given up in getting treatment and end up risking their lives when using painkillers to maintain the pain for longer time. I was told it's normal, and every time I visited the hospital, okay, so alikuwa ameambiwa ni normal every time she visited the hospital. But I traveled outside the country, and that is where she got diagnosed and treated.
Oh, she got diagnosed with polycystic or endometriosis?
Should be endometriosis, one of the two. And so maybe on that, the thing would be, please get help. We've said there's help.
Yes,
there truly is help. And so we speak about this. You see what we were speaking about, stigma, is that for her, alifanya hangeweza kuiongelea, so alikuwa na manage na painkillers. It had to take her traveling outside the country to get treatment. And so you have other people who are not able to travel outside the country. And so what that means is that they live with this problem for the rest of their lives, just because you don't want them to hear them speak about maternal health issues. Let people speak about their issues and get the help that they need. Sindio?
Yes.
Anasema, thank you so much, Dr. Felix. You need to come back. Unaelezea vizuri sana. You made us understand. God bless you.
Thank you.
Yes, asante sana. You didn't say your name. Please say your name so that we'd get to know who you are and where you are watching us from. That would be great. All right. Now, Doc, for the people who would like to get treatment or to come for consultation, where can they get you, and do you have a contact that you'd share?
No, thank you very much. Yes, to my viewers, I practice in many places, but in Nakuru, you will get me, and in Nakuru Specialist Hospital, located at Kiondo area, Lanet, we work as a team. We believe in system empowerment, so that if you don't find Dr. Atisa, you can find one or two of my colleagues, so that you do not suffer because Atisa was not available. So we are there every day. We run gynecology clinics every day, but more specifically on Wednesdays and Fridays. You will either find me there any of those days or both of them. If you don't find me, you will find my equally capable colleagues either of those days. We are ready to listen to you. So that is where you find me in Nakuru, at Nakuru Specialist Hospital, especially Wednesdays and Fridays. If there is an emergency, we are available 24 hours. Remember, as I said, we are a system, and we want to empower a system, and a system that works for everyone. You may not find me at 2 a.m., but you will find service by one of my colleagues, if not me. I'm also available at the Eldama Ravine Sub-County Hospital, and we run our clinics every Monday with my other colleague there, and you will also find me there any of those fine days. Weekends, you are unlikely to find me because weekends I'm usually in the village, bonding with my people and discussing what is going, how we can improve our lifestyles, you know, because a life living is in full totality, and we say by WHO definition of health is not just absence of disease, but is full well-being, financially, spiritually, emotionally, not just absence of disease. So most weekends I'm usually in the village, and I'm really enjoying the process. I'm learning a lot. There is a lot, and I will urge all professionals, all of us, you know, the young, the old, the middle class, the Gen Zs, create some time for your villages. Once in a while, you don't have to do every weekend like me, but get some time at least once a month. Travel to the village if you can, mingle with your people, you know, and get to know. It broadens you. You start seeing these things differently. You start realizing that healthcare is not cheap. So when you tell people they must do their pap smears, you must. That is good. I will say it, but acutely aware that our people in the village don't have even transport of 100 shillings, let alone affording pap smears. So that when you go to the village, you are able to lobby governments to seek funding or to allocate more budgets so that some of these services become free
easily available
and available. So of what help will Dr. Tisa do if I'm preaching every day for ladies to do pap smears, while my mother, my grandmother, my aunt in the village cannot afford even 100 shillings to go to town and have the pap smear. So it is through going to the villages we do this. So weekdays, find me at any of those facilities, and feel free. When you're with me, discuss everything and anything.
All right. Do you have a contact with call?
Oh yes.
Please share.
You can reach us on these two numbers. This one will be available 100% of the time because it's our hospital contact number. 07 00 907 000. It's a very easy number.
Take it again.
0700 907 000.
Okay.
So that is our hospital contact number.
You
will reach this number even now. You will be received.
All right.
My number is public. But when you don't reach me, don't lynch me. I'm sometimes not available. Like right now, I'm on this show.
Yes.
It is 0720 246 118.
Take it again.
0720 246 118. That you can also reach me. If you can't send me a message on WhatsApp or message, I will call back if you don't reach me immediately.
All right. Perfect. That has been great. Thank you for that session.
Thank you.
We've been able to learn so much, not only about endometriosis, but PCOS as well. A little bit about infertility, and so it has been such a wholesome conversation and so much to learn from that. And so if you're out there and you've not been able to follow the whole conversation, kwenye MBCI TV on Facebook and MBCI TV official on YouTube, we have had this conversation yote. So go back and listen to the whole conversation so that you'd be able to get a thing or two, but also share these links with other people so that they'd get to understand what we've talked about as well. God bless you. Do have an amazing rest of the day. Remember that this week, as we said while we were starting, should be a week that is full of blessings for you. And how you do that is be very intentional in it. Have a good relationship with your God and with other people. That is very important. All right. And that's said and done. We have a conference that is ongoing, and I'd like to invite you. And so if you're a member of Kingdom Seekers Fellowship or not, feel free to attend this particular meeting. And this is the National Prayers, National Territorial Dominion Prayers. It's a 3-day prayer meeting. It will be happening at Heaven's Gate Prayer Mountain. It's a 26 hours of worship. So do not miss out. It will be starting from 18th to 20th. All right? So don't miss out. Do come around Heaven's Gate and Apale. If you're not around there, please go. If you've not been able to go, we'll be live on Facebook, we'll be live on YouTube, on MBCI TV, we'll be live on MBCI TV, we'll be live on radio and all our social media pages so that you will not miss out. So please tune in and call other people so that we'll get blessed together. All right? So for that, do have an amazing rest of the day. My name is Rachel Kahogo. Today you have been in studio with Dr. Felix Atisa. Do have an amazing rest of the day. Bye-bye.
Thank you.